What's up, people?
What up, though?
What's up, Detroiters? Welcome to the People Mover podcast, where every week we talk about everything from living in Detroit, life lessons and experiences, dating, relationships, pop culture, and much, much more.
We explore the power of social connection through conversation. We literally want to move the people.
It's your host, Miracle, and our other host,
It's Malcolm Elliott, and we are back with another episode. And we are live from Conant Dental Center. I'm sitting here with a very special guest. Why don't you let people know who you are and what you do?
My name is Akeem Taylor. I'm the owner of Conant Gardens Dental Center. Some of you may know me as the Hygiene King. And I just want to say it's an honor and a privilege to be on here with y'all. Two of the realest people I know. So thank you.
You heard him. Thank you for coming on.
For the Hygiene King.
Exactly.
His Majesty has blessed us with his presence, with his grace. Thank you. Now, tell us, Hygiene King, Mr. Taylor, how long have you worked here at Conant Gardens Dental Center?
Well, this was my dad's practice, so really I've been working for like 20 years because he literally used to have me here as a kid. So, I've been learning about oral hygiene all my life. So, now I feel like it's my job to help spread that knowledge.
Okay, cool. Yeah, no, oral hygiene is one of the most important things people can take care of in their own day-to-day lives. And so I know, Miracle will tell you as well, we have partnered with a foundation, Making It Count Foundation, that has, anti-tobacco, anti-menthol initiatives going on. And, we are trying to spread awareness with that as well. Tell us, I'm sure as working here 20 years of your life, you've seen, a bunch of different oral problems. Like, just to keep it blunt. What can you tell us personally just about people who use tobacco regularly when they come into here?
One of the first things is you can always tell. The first thing you can usually tell is by the staining, because when you blow that out of your mouth, it always passes by your teeth. So you can always tell, especially on the middle side of the mouth, you can always tell by the staining. You can tell by the bone loss, and you can just, a lot of times, to be honest, you can just smell it off rip. But that's a lot of times because people are nervous when they come here. Mm-hmm. So they feel like they need to take a few puffs beforehand. That makes sense. So that's one of the biggest signs that I see. And I see a lot of bone loss too, and it's just real obvious because smoking is one of the fastest ways to get your teeth to start being loose as an adult. Yeah.
Y'all heard him.
That
loose tooth Sally. He talking about you. He talking about you.
No, I was like, can you tell us the effects of tobacco? Obviously, it yellows your teeth a little bit. You lose a little bit of bone. You were saying, like, anything else that happens when you are smoking to your teeth?
I can show you.
Yes.
So what happens is this pink area is your gums.
Got props.
That's where your bone is. What tobacco does, it starts to deteriorate this area. And that's the area that holds your teeth in place.
Okay.
So that's why a lot of times when people's teeth become loose is because of all that nicotine and tobacco going into their teeth. And if you don't clean your teeth well, all that stuff gets trapped in there over time.
Right.
Like you haven't had like a deep cleaning in like 2 years. Mm-hmm. You probably have like 2 years of smoke and tobacco just built up in there.
Yeah. So I'm like, if you're a smoker, because a lot of people in the city are, which, we should put the cigarettes down, put everything down.
Put the vapes down.
Like, what are some things you can do to improve your oral health? I feel like, is it something brushing your teeth or using whitening strips can prevent, or is it just stop smoking, period?
Well, stopping smoking is like the best way to do, but also it's kind of double impacted because people don't come to the dentist very often. They don't get their teeth cleaned very often. So
capitalism.
If you got all that stuff built up and you're not getting your teeth clean, you don't have it. Ooh, that's a story for another day because these insurance companies and these dental offices be charging crazy prices. But you know, I always try to advertise. You know, we got the best prices in the city.
Man, listen, they've been taking care of the hood for many moons.
And even on the topic of like vaping, I think that like one of the things that's so bad about vaping is it's so easily doable indoors.
The accessibility.
Yeah, it's like if you have like a cigarette, at least you're gonna go outside.
Yeah, it's the
But
convenience. It's too convenient. Yeah.
Exactly.
But like if you got a vape, all you really gotta do is go to the next room. And
Man,
all
just
you gotta do is go to the
bathroom, go in the stall, little hit. Man.
So even if like vaping might not have the same chemicals, it's the point of like you can hit it so many more times. Like you can be in the next room as a patient, hit the vape, or you could wait for the dentist to leave out the room, hit the vape, and just keep doing it. So
it's like when you see people lose the vape, that's when I knew psychosis was part of the problem as well, because it affects your brain. It does. The chemicals. The warning is on the label. That's what the warning is.
Label, and it is really hard for people to quit. Does your dental office like offer, things for people who are trying to like quit smoking, or no?
honestly, just I think when I ask people if they smoke before they tell me they do, they always be like, "How'd you know that?" And the fact that it's obvious that they smoke, it kind of gives them like a awakening. Like, wow, he's able to see that I smoke without even asking me. It's like I asked him to be nice.
He like I look burnt out. Wow. Wow.
Like, trust me, I already know you smoke.
It's just a formality. It's just protocol. We was gonna ask you that regardless.
Then it's like once you explain to them, because a lot of things are like just lack of education. So it's like it's not just about fixing, cleaning. It's all about educating. So when you come back here, hopefully you're doing better.
Healthy habits.
Once you know better, you do better.
Yeah, exactly. And how to properly take care of your teeth moving forward. Because this is it. You know what I'm saying? This is all we got.
We got veneers. We got veneers. These days.
Oh no, jeez.
Yeah,
Oh my Jesus, the veneers, the stories about those sound crazy.
No,
too.
and when you think of smoking, you think of like lung cancers and other cancers. And I'm like, are there any mouth cancers that people should worry about when they're smoking?
Yes, because of course all that smoke, all those chemicals are going into your mouth, and a lot of times if you have like cuts, imagine that smoke going into those cuts. If you like brush your tongue too hard and your tongue start bleeding, all that smoke going on your tongue, so that increases those risks. And then like you said something about how it affects your brain. Now I'm not trying to get into chemist talk or anything, but
That's for
it like affects your dopamine receptors. Like whenever you do something artificial so long, your body becomes used to that.
yeah.
So things like going for a walks or hearing your kids talk to you, it's like the things that would normally make you happy, those dopamine receptors don't respond the same because they're used to those chemicals affecting your brain. Whereas like the only thing that can really calm me down is a blunt or a cigarette.
No,
Your
literally.
brain is equating
Yeah.
happiness or some type of solitude.
Exactly. So, like, in general, what advice would you give people to do to keep, like, a healthy oral health? Smokers and non-smokers. Like, what do you think people need to be doing more regular? Obviously, come get checkups yearly. If you can't do that, what can you do at home? Like flossing, toothpaste, all of the above, or...
I'd say the most important thing is brushing before bed because the saliva in your mouth, like throughout the day, that's why we don't get morning breath because we're constantly talking. So that spit is kind of constantly getting that food off.
I didn't know that.
But when we're asleep, our mouths are usually dry. So that bacteria is just sitting there for hours and hours and hours. That's why when people wake up,
Malcolm's face. The PTSD.
No, facts.
Fungus.
That's why, like, I know it sounds nasty, but like people who drool often have less morning breath than people who don't drool because at least you got a little flow right there.
Yeah, moisture a little bit.
But when
you know
it's
what I
just
mean?
sitting there, everything you done ate throughout the day, the bacteria is just eating on that, and
Yeah.
you know.
Even the tobacco bacteria, you know what I'm saying? Tobacco, menthol. I always tell the horror story when I was telling her, like, I seen like a small children walking around smoking vapes now, and it's just becoming, like you said, too accessible. It's becoming too alarming. How do you feel about, like, you know, tobacco use specifically in the Black community, and like what you see about it?
I say a lot of it comes from us being stressed and depressed, to be honest with you. We be needing those escapes because in the Black community, we are so down bad. We don't know how to take care of our mental health. You know, we just run to the bottle, or we run to we run to the vices. So I think that's one of the biggest things. And then because, you know, a vape or like a breeze costs like $16, $20, and you get to fulfill your vice for a whole week anywhere and everywhere. So it's like one of those chicken and egg effects. Like, we're so down and out, we're so depressed. Let me just try to hit this vape to feel a little bit better. Even if it's only like 5% better, I can get that 5% better any place, anytime. So I always think about like things like we got to go to the root of the cause. Not just what's going on, like what we see, but it's like the why.
The why.
Like, why are these kids, 16-year-olds, why do they feel the need already to vape? Like, what's going on at home?
What's going on? Yeah, exactly.
What's their financial situation looking like?
That's true.
You know, you might have a lot of anger built up, and it's like, you know, I want to beat so-and-so ass.
Exactly.
Let me just hit this vape real quick to calm down.
Yeah. No, that is a big thing.
Coping mechanisms.
Coping mechanisms, exactly, and like stress relievers. But shout out to you guys too, because I know you guys do free cleanings for people. You know what I mean? So I'm like, people do need to put the cigarettes down, but I get it. You know what I mean? But
I don't get it. I know I don't. Put them down.
Put them down.
Put 'em
No,
down.
I get it, but I'm like, you gotta think of your future. Think of your smile. You know, you don't want to be that lady with
the hole in the
or with two teeth or two tooths. You
two
know?
tooths. Two tooths. Two tooths.
You
Those
don't want.
commercials will sometimes come on at the office. And
Bro.
I'll be like, see?
Literally. And you don't want to be that person smoking because, like you said, you can smell it. And I'm like, you can smell when guys smoke as well. You don't want to like offend your partner or the people around you. Like, you don't want people to not be around you. You know what I
Really,
mean?
just the addictive behavior of being a smoker. It's like, you know, like people with the cigarettes would hit the pack and go outside in the blizzard to hit. Man, come outside, hit the square. I'm not going outside there in the ice age with you.
In 0-degree weather, no.
Who do I look like? Sid the Slaw? What do I look like? I'm not doing that.
There are other options, you guys. There are other things you can do
There are other things you can do, but yeah,
that are not gonna kill you. You know what I mean?
we got to do something. We got to fight back. We all got to stand up. We don't have to give in to temptation. You know what I'm saying? Man, we appreciate the Hygiene King. You know,
Yes, the
giving us
Hygiene King,
some of
guys.
his time from his royal schedule.
Floss your
'Cause this
teeth.
man's got a lot
Use
on
your
his plate.
mouthwash. Use your toothpaste.
Floss.
Can I get him a few more tips real quick?
Yes,
Just a few,
please.
more tips. You know, start working out. Because once you're on that treadmill, you start feeling them Black and Miles and them blunts.
Yes.
Once you,
We know about it.
even like in your intimate life, like men in your intimate life, if you want to
Exactly.
give the best performance, put them
Exactly.
cigarettes down.
Put them cigarettes down, please.
Because, like, when you on that treadmill, when you like,
Yeah, literally. People walk up one flight of stairs and they can't even do that. You know what I mean? So it's like, take care of your lungs for sure. Take care of clock that teeth. No, take care of yourself for sure.
yeah, you know, just it's all about just like you said, habits and things we do on our daily basis. We just gotta find better ways to replace those habits. Like you know, just
Exactly.
go on for a walk.
Going for a walk, man. Exactly. Journaling.
Yeah, touching grass.
Touching grass.
We all on our phones.
There's nicotine patches as well. There's nicotine gum. I don't know how you feel about gum. Oh, you don't recommend.
I mean, because that's just getting the nicotine from another source.
That's true. But if you want to ease into it, like, is gum bad for your teeth or does it?
No, I highly recommend gum because gum helps to like plunge food out your teeth. Like I hate chewing gum after I eat because I'm like, you can't even taste the gum. You just taste the food. You just
yeah.
So like,
That's true.
but always drink water before bed too. That should always be the last thing, just because that helps you one last rinse. Like if you know you come home hungover one day or you too hot to brush your teeth, just swish some water. Swish some water. That's the least you could do.
Bare minimum.
Swish with some water. I tell people that all the time.
Oh yeah.
The very least, man, please tell the people where they can find you at and support you.
So my Instagram name is the Hygiene King. Business page is Conant Gardens Dental. We're located at 2430 East 7 Mile Road, Detroit, Michigan 48234. We've been serving the community for over 30 years. Best prices in the city. We price match.
Yes. You heard him.
Black owned, family friendly environment.
Halfway.
And we specialize with kids. So if you got some kids that's scared or you got some old people that's scared, we got you.
Yes.
And this is why they call him the Hygiene King.
The Hygiene
Ladies
King.
and gentlemen, out here on 7 Mile, holding it down.
Yes.
7 Mile legend, my boy Akeem Taylor.
Yes, Akeem.
7 Mile,
thank you so much for educating the people.
Please, thank you. You guys can follow me everywhere at Malcolm Elliott Music on everything. And you guys can find me and Miracle here every week at The People Mover Pod on everything. New episode.
Woo!
Let's do it. Shout out to Making It Count Foundation.
Yeah, shout out Making It
We
Count.
love you.
Thank
Keep
you
doing
guys.
great things in the community.
Let's drop that old one that we used to do back in the days.